Um, Good afternoon, class. Remember the last time, well, thank you for joining. Remember the last time we talked about the pelvic bone? I told you that we are going to be, in our next class, we're going to be talking about the obturator foramen and the rest of the pelvic bone. Well, in this class, we are going to be talking about uh, the uh, the 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 obturator foramen. Now, I want you to listen closely. Remember that I told you that a large that we use an analogy that the pelvic bone, there are like three sisters: the ilium, the ischium, and the pubis. Now, and I told you that the ilium and the ischium and the pubis, okay, inferiorly meets inferiorly to form through the istiopubic ramus here, and so thereby in the process of meeting they form a foramen called the obturator foramen. Now it is important. Remember, I told you the last time that this foramen is closed up by an obturator membrane. Now, it should be better for you to take note of these things I'm going to be saying. So, the obturator foramen is a large opening created by these two jealous sisters, that's the ischium and the pubis, through which nerves and blood vessels passes. So in a bid to hide their creation, because they have been able to meet here and form the obturator foramen, they need to hide their creation, and they do this by inventing an obturator membrane, a very strong obturator membrane that covers this foramen. Okay, so it covers this foramen except an area here, and except an area here called there's a groove superiorly here. So this groove is called the obturator groove. Okay, around here. So sorry, let me put the arrow here. So that groove here is called the obturator groove. This obturator groove was converted to a canal, so it's going to be called the obturator canal, and it's a groove that was converted by the obturator canal through a specialized uh, 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 ligamentous band called the obturator membrane. You know, the obturator membrane is covering this obturator foramen. So it's going to be converted to the obturator canal. So, and the function of the obturator canal is for vessels, is for the obturator artery, the obturator vein, and the obturator nerve to pass through the foramen out of the pelvis. So here in the obturator canal, the obturator artery, obturator vein, and obturator nerve passes through this canal. Now, this obturator canal. But before we talk about the some of the branches of the obturator artery, let's talk about the acetabulum. Let's talk about the acetabulum. So this is the bone we are going to be talking about here. So so let's move this bone away and bring the acetabulum here. Okay, so now sorry for this image. This image is very bad, but so bear with me. Now look at the acetabulum. Now the acetabulum. Remember, I told you in a recap. The the three sisters will get married to a rich man, and that rich man is the largest bone in the body. So he's rich, the largest bone in the body, that's the femur. But before they get married to this bone, they will have to unite, isn't it, and hold hands together, thereby forming a strong ring. It is this strong ring that is called the acetabulum. Okay, this strong ring is called the acetabulum. But they still remember that the ischium and the pubis, they still hate the ilium. They hate the ilium. But somebody will ask me, what do you think could have caused this hatred between these sisters? Well, the truth is, understandably, the ilium only contributes below 2/5 of the acetabulum, but the ischium contributes above 2/5 of the acetabulum. So you see where the hatred is coming from. So to the acetabulum, the ischium contributes more to the acetabulum, more than the ilium that is the biggest and the most beautiful. So maybe this is what caused the hatred. Of course, the pubis forms the rest of the acetabulum near the midline. So you now know where the source of this hatred. So the acetabulum has a feature. Okay, there are features to the acetabulum, and one of those features of the acetabulum is, if you notice, on the outer area of the acetabulum, we have the acetabular labrum. Acetabular labrum. So let's make use of this labeling here. The acetabular labrum. That should be ASETABULAR. Then labrum is LABRUM. Sorry, the picture is very bad. Okay, so the acetabular labrum. So this acetabular labrum is the outer ring that reduces the opening and deepens the surface for formation of the hip joint. So just like if you remember the glenoid labrum in the humerus, when we're talking about the shoulder joint, the humerus, so it also forms this acetabular labrum, also has the same function as the glenoid labrum. So another thing I want you to take note is the acetabular notch. The acetabular notch. So the acetabular notch is well, with this image you might not really see the acetabular notch. So it will be better for me to pick another image for you so that you understand where I'm coming from. The acetabular notch. The acetabular notch. So look at this image. Let's pick this image. If you notice, look at this image. In the acetabulum here, we have a notch here. If you notice, the ring is not complete inferiorly. This ring is not complete inferiorly here. So the incomplete inferior part of the acetabulum, okay, is actually the acetabular notch. So at the lower part of the acetabulum, the acetabular notch is located at the lower part of the acetabulum, and it is continuous with the circular depression, which is the acetabular fossa. Okay, here we have the acetabular fossa here. So we have the acetabular fossa here. So the acetabular notch is just the lower part of the acetabulum. Okay, so the notch is converted to a foramen. The notch is converted to a foramen. It is a notch, but then later on it's going to be converted to a foramen. Remember, when we were talking about the greater sciatic notch and greater sciatic foramen, where I said greater sciatic notch and lesser sciatic notch, where I told you that in life they are going to be converted to a foramen. So this acetabular notch is going to be converted to a foramen by a ligament called a transverse acetabular ligament. So let's go back to the image that we we were using the other time. So let's take this away here. So let's go back to this image. So if you notice this image, there is an acetabular notch here. So this acetabular notch down here, that's the acetabular notch down there, has been converted to the acetabular foramen. Has been converted by the acetabular foramen through the transverse acetabular ligament. So this transverse acetabular ligament is moving from this place to this place. So transverse acetabular ligament converts the acetabular notch into the acetabular foramen. Of course, the acetabular foramen it's where the nutrient vessels and nerves enter the joint. So it is a joint. This joint needs to, the joint that is going to be formed by this acetabulum and the head of the humerus needs blood supply. So it is the acetabular foramen that will afford the opportunity for vessels to pierce through. Now, there's also something I have not talked about. If you notice this area of the acetabulum, it has a smooth depression. It has a smooth depression there. So we are going to be calling that the lunate surface. So this part of the acetabulum is going to be called the lunate surface. So it forms most of the acetabulum actually, and it is curved and crescent, moon shape. So you can see that it has a moon shape. Okay, it has a moon shape. So we call that the lunate surface. Of course, you know that since the acetabulum has an acetabular notch that has been converted to an acetabular foramen, blood supply needs to come in. So the blood supply to the acetabulum is from the acetabular branch of the obturator artery via the acetabular notch. So let me see if I can explain that with an image. So let's keep this image here and bring this one over. Bring this one over here. Okay. Okay. So before we use this, let's make use of this. To be better to make use of this. Look at this image here. If you notice, through the obturator foramen here, the obturator artery, which is a branch of the internal iliac artery, emerges, okay, out of the pelvis. Okay, emerges out of the pelvis. So it gives different branches. If you look at these blades, it gives an anterior branch. It gives an anterior branch. Okay, it gives an anterior branch. Then it also gives an acetabular branch. Sorry, this image is very poor. Okay, it gives an acetabular branch. So we have two branches. So this acetabular branch goes up into the acetabulum, through the acetabular foramen. So if you notice there, we have, of course, here, let's represent this with a yellow line. So we have the transverse acetabular ligament converting the acetabular notch into a foramen. So the artery, the acetabular branch from the obturator artery, we have to go into the acetabulum to supply the acetabular region. So that's how the blood supply from the blood supply to the acetabulum, that's how it comes about. Now it is important to state, it is important to look at the joint formed by somebody asked me a question. A student asked me a question a few minutes ago before I started his lecture. That why is it that we are only calling this? Actually, that's not how she asked the question, but I'm just rephrasing now. Why is it that we are busy calling this bone the pelvic bone? What's the difference between the pelvic bone and the pelvis? I told the person the pelvis is actually an area between the abdomen and the perineum. Okay, so but when we say the pelvic bone, we are not only talking about these two bones here, 1 and 2. We are also talking about this bone here, 3, which is the sacrum. So we are also talking about this bone here, which is the sacrum. So we have, and of course we have joints. We have joints around this bone. So we have 1 and 2, which is pretty much the same. Then we have number 3 here. Okay, but we have more than 3 joints actually. So let's pick one of those joints. We have 2 sacroiliac joints. So we have 2 sacroiliac joints. There's a joint between the ilium, okay, between the ilium and the sacrum. So the sacrum. So we have 2 sacroiliac joints from the word sacral bone and the iliac bone. So 2 joints here. So then we have another joint here called the pubic symphysis. We have now I will have you know that the sacroiliac joints, they are atypical synovial joints, okay, and they have a very limited range of movement. I'm talking about these 2 joints here. They have very limited range of movement. Then we also have a joint called the sacrococcygeal joint. The sacrococcygeal joints are joint between the sacrum, this bone here, the sacrum, this bone here, and this bone here is called the coccyx. Okay, so there's a joint between the coccyx and the sacrum. There's a joint between the coccyx and the sacrum here. So this is the sacrum and this is the coccyx. So there's a joint between the 2 of them here. So we are going to be calling that joint the sacrococcygeal joint. The sacrococcygeal joint is SACROCOCCYGEAL. It is a secondary cartilaginous joint. Okay, it is a secondary cartilaginous joint. Then we have the pubic symphysis. We have the pubic symphysis here. Of course, we spoke about this joint in our last class. The joint between the symphysial surfaces of the 2 pelvic bone, of the 2 pelvic bone. Okay, so that is that. Let me pick this one. Let me pick this bone. Okay, remember yesterday I was asking you, is there any difference between the male pelvis and the female pelvis? Is there any difference between the male pelvis, or any are there differences between the male pelvic bone or the male pelvis and the female pelvis? And I give that as an assignment. So in our next class, I want you to before our next class, I want you to I will pass a message across about this assignment and how you're going to be submitting your assignment to me. So thank you for listening. We'll meet again in our next class. Thank you so much. My name remains Akuna Gabriel, and you can, of course, send me a message or call me, send me a WhatsApp message, and to let me know what you think about this class. So my phone number remains 08038619526. You can send me a message on WhatsApp, a text message to tell me what you think about the video and how we can improve the video. All right, thank you and have a nice